Now, the World Health Organization praises efforts to contain COVID-19 in Dharavi, Mumbai. WHO Chief Tedros says, and I quote, Dharavi, a densely packed area in the megacity of Mumbai, a strong focus on community engagement and the basics of testing, tracing, isolating and treating all those people who were sick was key to breaking the chain of transmission and suppressing the virus. Here, Tedros, the chief of the WHO, praising the efforts of Dharavi. In fact, Dharavi was one of the first slums, the largest slum in Asia that first reported cases of COVID-19 erupt. And here we're looking at Dharavi coping with the pandemic fairly well in compared to several other city limits as well. Here we're looking at Tedros, who's the chief of the WHO, praising Dharavi and the way they managed to fight the virus.
There are many examples from around the world that have shown that even if the outbreak is very intense, it can still be brought back under control. And some of these examples are Italy, Spain, South Korea, and even in Dharavi, a densely packed area in the megacity of Mumbai.
Let's quickly cut across to Mustafa Sheikh joining us on the phone line. Mustafa, Dharavi is lauded for its efforts to contain the pandemic. It's a slum area, yet somehow they managed to contain the spread. Take us through what really Dharavi did that maybe cities can emulate.
Well, Nabila, there was chase the virus policy by the BMC. There were special efforts by the local officers to first, on the one hand, isolate those people who are showing symptoms so that the community transmission can be stopped. People who were testing positive in the last days of the virus were already in the quarantine homes, and hence there was lesser spread of the virus, which helped the agencies in Dharavi to control the virus. At the same point of time, there were different hospitals and quarantine facilities inside Dharavi which were built up so that the critical treatment can be provided to patients who have comorbidities, who have senior citizens. So there was an attempt from the other end to control the death rate in that area. And also the big role was played by the migrant crisis, because around 70,000 migrants who were working at that point of time, Dharavi had left as people in the lockdown were leaving for their homes. So there were different aspects which worked in the favor of PMC there. So there was transparent information given about the entire Dharavi policy, and we knew what were the numbers. And about a month back, the numbers started decreasing, and now there are very few cases which are coming out from the city of Dharavi. And I think that is something which the WHO has taken note of, that being in such a huge chunk of population in a crowded area, virus like COVID-19 was controlled back to you.
Right, Mustafa, thank you very much for joining us. Here you have WHO Chief praising Dharavi and its efforts to contain the spread of coronavirus in the slum area.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.